In the battle against coronavirus and the current Omicron surge, local experts warn people not to count on antivirals. Welcome to the news at 6. I'm Morgan Romero. The federal government recently announced 2 antivirals are available to treat COVID, but getting a hold of them in Idaho is proving to be tough. Andrew Bartline spoke with a local nurse practitioner who's been working hard to prescribe those antivirals. Andrew, what's making it so tough?
Well, the FDA authorized both antivirals to treat coronavirus back in December, and they warned that it'd be extremely limited. And now, more than a month later, supply continues to be a big problem across the United States, and especially here in the Gem State. 2 antiviral drugs are available in Idaho to treat COVID-19 patients after infection.
One of them, the Paxlovid, is pretty good at reducing things like hospitalizations and death.
The other is Monupiravir. Nurse practitioner Brad Bigford says for a patient to qualify for the treatment, they first need a positive COVID test. They also need to be at high risk for hospitalization or death, but even then, availability of the drug is a problem in Idaho.
I have some resources where I'm able to check to see what the availability is.
Bigford says on average he prescribes the drug up to 5 times a day.
It happens, at least once a day in terms of patient qualifies for it. We try to get it, and then there's a barrier.
Outside of short supply, another barrier is timing. Bigford says these antiviral drugs need to be taken within 5 days of infection to be effective, making immediate supply a necessity. But according to the Department of Health and Human Services, there are currently 93 courses of Paxlovid available in Idaho. In fact, HHS numbers show Idaho has one of the lowest rates of available Paxlovid courses in the country. And that's concerning to state health experts like Dr. David Pate, as the Omicron variant rapidly spreads through the Gem State.
It's disappointing. I would love it if natural immunity was permanent or at least much more durable. It doesn't seem to be.
There are 2 different strains of the Omicron variant. The state reported finding the second, more transmissible strain in Ada County late last week. And Dr. Pate says early data out of Europe shows the second Omicron strain can cause reinfection within 4 to 6 weeks.
It just means that people that get naturally infected, you cannot count that you're going to have protection against the next strain.
Numbers from the Department of Health and Welfare continue to show fully vaccinated Idahoans are 1/3 as likely to catch COVID compared to those not fully vaccinated. And as antiviral drugs remain in short supply, providers like Brad are frustrated to see some patients pass on the vaccine.
So they're willing to do the newer treatments, but they're not willing to do the things that are the most effective in terms of prevention.
Outside of these 2 antivirals, the monoclonal antibody called sotrovimab is another treatment option for patients at high risk for severe disease right now. We recently reported they are also in short supply. Tomorrow at Health and Welfare's media briefing, we expect to get a better idea about the current supply for all of these treatment options and what the state plans to do to get more. Morgan?
Yeah, Andrew, a little disheartening to know that treatment options are so limited. Thank you.